Okay, so I hope everybody's having a good day. Ms. Stewart here, and in this section of notes we are going to talk about CPR and AED for children. Specifically, we're going to be looking at when it is appropriate to give CPR for a child, how to give CPR to a child, and then when to use an AED on the child. There's going to be some information in the set of notes that's going to be a little repetitive because there's a lot of similarities between child CPR and adult CPR. So if that's the case, then I'll probably go over those slides fairly quickly since we've already gone over that information in the adult segment. So first, it's important to know for the purpose of this course and for the skills that we practice and teach in this course, that a child is defined as the age of 1 year up to puberty. And of course, the signs of puberty for males would be chest and underarm hair, and of course, breast development for females. Of course, if you're ever in doubt whether someone is considered an adult or a child, you want to make sure that you provide emergency care as if the person is an adult. And of course, the definition of a child is different when using an AED compared with providing CPR, and we will discuss that when we get to the section on defibrillation. So just like the adult, the pediatric chain of survival shows the most important actions needed to treat cardiac arrest in children that occur outside of the hospital setting. Now, during this course, we really focus on those first 3 links of the chain because those are the responsibility of the lay rescuer. Now, the 4th and the 5th links are advanced care provided by emergency responders and hospital providers who essentially take over from that point. But again, those first 3 links are really important for you as the lay responder. Now, that first link is really focusing on prevention. So we're looking at preventing injury and sudden cardiac arrest. Is really that first important step that we want to always consistently be thinking about. How do we prevent injury? How do we prevent sudden cardiac arrest? That second link obviously is going to talk about high quality CPR. So the sooner that you can provide high quality CPR for someone in cardiac arrest, of course, the better their chances of survival. And then, of course, the third link is going to be phoning 911. Now, you're going to notice that there is a difference here than the adult chain of survival. The adult chain of survival actually had you calling first and then starting CPR. Because pediatric victims, and for the sake of this slide, we're talking about a child and an infant, because pediatric victims typically suffer from respiratory issues versus cardiac issues, it's really important that we start to provide aid first. And so that third link is going to be calling 911 as soon as possible so that the child can have emergency care quickly to improve their overall survival outcome. So again, prevention is going to be first. Second is going to be starting CPR, obviously, if you're by yourself. And then third, after about a 2-minute window, you're going to want to make sure that you leave the child if need be and go to the phone. Babies, you can take them with you, but then you would try to get someone to call 911. And then, of course, early advanced care would be those last 2 links. So let's talk about the steps here for providing CPR for a child. And obviously we want to make sure that we assess and phone 911. And when we look at assessment, we're really looking first and foremost, we always want to make sure that the scene is safe. We want to make sure that the scene is safe for the rescuer and for the victim. We want to make sure that we check for responsiveness. So we're going to do that by tapping on the shoulders and shouting, "Are you okay? Are you okay?" And then of course we want to make sure we shout for help. Obviously, if anybody is around that can assist, you want to make sure you have them phone 911, get an AED and a first aid kit. And of course, because we're talking about a child victim at this point, if no one is around and you're by yourself and you check for responsiveness and they're not responding, then you're immediately going to want to start to provide about 2 minutes of aid before you leave the victim and call 911. So after you have checked for responsiveness and determined whether or not you can send someone to call or you're going to have to wait for those 2 minutes, then you want to check for what we call signs of life. Again, it's the same as with the adult. We're checking for normal breathing, checking for movement, looking down the body line of the victim, looking to see if we see rise and fall of the chest. And of course, if there are signs of life present and the victim is breathing on their own, we most certainly want to make sure that we stay with them, but we can roll them over onto their side, call the recovery position, and help to keep the airway clear and continue to monitor them. Unfortunate situation, if there are no signs present, then we want to start CPR beginning with compressions. So obviously we're going to give 30 compressions and 2 ventilations. After about a 2-minute window, which is about 30 compressions, 2 breaths for 5 cycles, but roughly 2 minutes is what we say. If no one has come to help and no one has contacted 911, at that point is when you need to leave the victim, or if it's an infant, carry the victim with you to the phone so that you can call for help. So just like the adult, and just like what we're going to see with the infant, there are 2 main skills that are included in CPR, compressions and breaths. And so we're going to talk about each of those skills individually and talk to you about how to perform those skills effectively. So the first is obviously you're going to provide compressions. Again, just like with the adult, we're going to push hard, we're going to push fast, we're going to need to allow for recoil, and we want to keep those interruptions to less than 10 seconds. Now, when we are talking about pushing hard for a child victim, we're essentially looking at how deep, okay? And so when we're looking for the child victim, we want to make sure that we push straight down at least 1/3 the depth of the chest, or it's about 2 inches. When we're looking at pushing fast, we're essentially looking at a rate of 100 to 120 compressions per minute. And of course, again, recoil essentially means in between each compression, you need to allow the chest to come back up to its normal resting period. Compression technique, again, is very similar to the adult. Victim should be on their back on a firm surface. You're going to use the heel of one hand on the center of the chest, in between the 2 nipples, if you will. So in the center of the chest on the nipple line there. And then you're going to use really a one-handed or a two-handed compression for the child. It really depends on 2 things. So if the strength of the rescuer and the size of the child really determine whether you use a one-handed or a two-handed compression. So obviously you can see on the bottom right, a two-handed compression would look just like what you do for the adult. And then of course if the rescuer has strength and the child is not very big and you can actually get down to about 2 inches in depth, then you can use a one-handed chest compression as well. You're still going to make sure that you push straight down, and you're going to make sure that you keep your elbow or your elbows locked in position. Now, after sets of compressions, obviously you've got to stop and be able to give 2 breaths. Just like with the adult, you want to make sure that when you ventilate, that you can see a visible chest rise is essentially what you're trying to achieve. You obviously have to be able to do an effective head tilt chin lift to open up the airway first. You're going to pinch off the nose, and then of course you're going to seal off the victim's mouth with your mouth, and you're going to breathe over a 1-second period, just long enough to make sure that the chest rises. And just like with the adult, when you're giving those 2 breaths, if you attempt to give a ventilation and the chest does not rise, the air does not go in, what you want to make sure you do is you want to retilt the head and try again. If you cannot get that next breath to go in, obviously you're going to bypass ventilations at that point, go down and give your 30 compressions, and then come back up and try again. What we're ultimately trying to do is give 2 consecutive effective breaths. And so we don't want to stay up at the head more than a 10-second window trying to get 2 breaths in. So once we give that first one, if we retilt, try again, and let's say the second one does go in, then you want to follow up with another breath so that you have 2 successful breaths. But if not, after you've retilt, try it again, and the air still doesn't go in, you just bypass and go back down to the chest for compressions. So putting it all together, again, is going to be the same for the adult, child, and infant. The first thing that you're going to do is check the scene for safety. The next thing you want to do is check for responsiveness by tapping the victim on the shoulders and shouting, "Are you okay?" Then, of course, you're going to shout for help. Hopefully, if somebody is around, you're going to send that individual to call 911, get a first aid kit and an AED. If not, then you need to stay and provide about 2 minutes of aid before you leave and go to the phone. You're then going to check the victim for normal breathing and movement. We call that signs of life, and you're going to check that for no more than a 10-second period. Obviously, if they do show signs of life, you want to continue to monitor their breathing, check for bleeding, medical ID, jewelry, can roll them over onto their side, known as the recovery position, but you always want to stay with them. Worst case scenario, they don't show signs of life, so then you're going to start compressions, 30 compressions, followed by 2 breaths, and of course you're going to use the AED as soon as it arrives to the scene. You're going to continue those sets of 30 compressions to 2 ventilations until the AED arrives, and you can momentarily pause CPR. EMTs, paramedics arrive to take over, someone with more advanced training arrives to take over, or the victim starts to show signs of life. Now, CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. AEDs can be used for children and infants as well as adults. Now, some AEDs can deliver a smaller shock dose for children and infants if you use child pads or you use a child cable key or a switch. If the AED can deliver the smaller shock dosage, use it for infants and children less than 8 years of age. And if the AED cannot deliver a child shock dose, you can use the adult pads and give an adult shock dose for infants and children less than a year old. So essentially, what we're trying to say here is that pads, they make adult pads and they make child pads. And we'll talk a little bit about this further on down the presentation. But if all you have is adult pads, you most certainly can use that on an adult, a child, or an infant. Obviously, if you have child pads, that would be the best option to use for a child victim and an infant victim. And we'll talk about how the placement is going to be different here in just a minute. But again, just like with the adult, an AED increases survival rates for the victim tremendously. They're very safe. They're very easy to use. And again, what they're trying to do is to provide some sort of counteraction to the most common rhythm, arrhythmia that an individual goes into during cardiac arrest, which is ventricular fibrillation. So that quivering, that useless quivering of the 2 chambers, lower chambers of the heart. And so the only way to counteract fibrillation is to defibrillate. Now, the use of the defibrillator is not going to change as far as the steps in the order. We're still going to follow triple P, double C. So the first thing you always want to do is power it on. Then you're going to place on the pads. Then you're going to clear the victim to plug it up. Then you're going to clear the victim to possible shock. And then, of course, if it allows you to touch the victim after shocking, or if a shock is not recommended, then you want to start back with compressions. So the first thing you want to do is power it on. So as soon as the AED arrives next to the victim's side, you want to turn on the power. Again, it could just be a simple lift of the lid will turn it on, but again, all AEDs are going to vary depending on the manufacturer. So there could be a power button, or you simply lift the lid. You want to make sure you look for on the AED to see if there actually is a child cable key or some sort of switch. So if that is the case, you most certainly want to switch over to the correct victim type. So if you're with the adult, you want to use it for the adult. If it is a child you're using the defibrillator on and it has a cable key or a switch, you want to make sure that you appropriately turn it to the child so that the correct shock dosage amount is used. And again, it's important to turn it on as soon as it arrives because it needs to run a self-check. Plus, it gives you voice prompt instructions on exactly what to do next. Secondly, you're going to put on the pads, and as I mentioned earlier, adult pads, all AEDs come with adult pads, which is the picture that you see on the top right there. Child pads look just like what you see on the screen. The picture itself looks like that of a little boy, and most of the time the child pads are going to direct you to put one pad on the center front part of the chest, and then you slightly roll the child over and put one on the center of the back. This would also be what you would do if all you have was adult pads for the infant, if you had child pads for the infant as well. So obviously if we tried to put adult pads on a child that small, the pads would cross over and they would actually, one would probably be overlapping the other, which is not what we want. So you want to make sure that if all you have is adult pads, then you most certainly can use adult pads on all the victims. You may just have to put one on the front, one on the back. And just like with the adult, you want to make sure that if you see a medication patch that you put on gloves first, and then you peel off the medication patch and wipe the area clean before you attach the AED pad. If you see the internal pacemaker scar, you want to make sure that the top pad is at least 1 inch away. And of course, if the victim's chest is wet for whatever reason, you definitely want to make sure that you take something and dry it off completely. Third step is going to be plug. You most certainly want to make sure, again, because of the safety feature of the AED, if anyone is moving, when the machine is plugged in, it will not charge. And so you've got to make sure you're very vocal, clear everyone away from the victim, including yourself, so that you can then plug in the machine so that it can start to analyze the rhythm. Next, you want to make sure you're very vocal in your clearance of the victim. It is possible that if you are touching a victim and you hit the shock button, that the voltage can travel from one person to the other. So it's really important that you make sure that yourself, any co-rescuers, any family members that may be in the area, that no one is touching the victim. And so you want to make sure that you're very vocal and that you've made it very clear that you're getting ready to shock and that no one needs to be touching the victim. And then finally, after you shock the victim, or if the machine tells you that no shock is advised, that you do start back with compressions. And as always, please make sure that you complete all remaining tasks inside this module and that you review all skill demonstration videos.